So the aligners are a sequence of different kind of clear aligners that you wear, one every week. Each week they're a slightly different shape so that your teeth can kind of drift into this position, and then by the time you finish the sequence of aligners, the teeth are aligned and in the position that we have planned for at the very beginning. Each aligner does a very small movement, and so often we find usually around the kind of 7, 8 or 9 aligner is when you kind of start to see a good difference from the beginning. It's an accumulative effect, so lots of little movements end up with big differences. So the further through your treatment you get, the more of a difference you see. The more you wear your aligners, the more effective they are. So we recommend 21 or 22 hours a day, so that you're just taking them out to eat with and taking them out to clean your teeth, or taking them out if you're drinking something other than water. So I find that my patients are really compliant, see the best results and progress through their treatment faster than patients who are maybe a little bit less compliant. So it's really in our patients' hands for that as well. The aligners are really subtle, they are clear, and once you're used to wearing them especially, they're pretty much invisible. Close up, yeah, maybe you can tell a little bit, but now aligners are such a common treatment that it's quite normal to see and not something that people kind of really focus in on. One of the real benefits of aligners is that you can take them out to clean your teeth and floss your teeth instead of having those fixed braces that are really hard to clean and create a lot of kind of gum issues if they're not cleaned well. The aligners are removable so you can clean and floss normally. So with all our aligner treatments, we give a little Zima pod at the start of treatment, which is a really small pod about this size that you plug in, and it can clean your aligners using kind of ultrasonic bubbles and just water. It's really great for kind of removing staining, keeping them super hygienic, and just keeping them kind of clean and comfortable to wear. Other than that, we recommend just soap and water and a little bit of a brush. Don't need to use toothpaste because that can be quite abrasive and cause the aligners to pick up staining a little bit more, but we're finding that the Zima pods are a really good way to look after your aligners. At the start, we recommend changing your aligners once a week, but some people's teeth move a little bit faster, like every 5 days, or if it's a particularly tricky movement, occasionally it's a little bit longer than a week. But here at Queen's Drive, we use dental remote monitoring system, which is a little scan box that you put on your phone, and every time you've come to the end of your aligner, you take a little scan and it uploads it to a portal that we can see, and it confirms that the aliner's done the full job. And so if every week you're ticking the green box and you're doing really well with wearing your aligners and really committed to the treatment, then often you can cut the change over to 5 days rather than 7 days. So I find that the remote monitoring that we use with all our patients cuts down treatment times. It means that you don't need to come into the dentist quite as often because we can see you remotely as well. It's just a really great system for progressing through your aligner treatments. The treatment is not uncomfortable. It's kind of similar to when kids and teenagers get the fixed braces. When they first go on and the teeth are getting used to moving, sometimes they can feel just ever so slightly tender. In that case, a paracetamol or ibuprofen should do the trick to just get you over that hurdle. With my patients, I find that once they're past aligners 1, 2 and 3, their teeth are used to moving, and when they move to the next aligners, everything's very comfortable from there on. So a very small adaptation period for the first 1 or 2 weeks, and then I don't get reports of discomfort from there. So retainers are lifelong retention. Teeth annoyingly have a little bit of a bounce back memory, so they like to move back to where they came from. That desire to move back is strongest when you first finish your aligner treatment, so retainers are extra important once you've finished the aligners for the first kind of 6 months. And then we do still recommend lifelong retention so that the teeth don't want to slowly drift back to where they came from. This can be removable retainers that you wear at night time, which is really great for protecting your teeth from kind of nighttime grinding habits as well. And it can also be little fixed retainers that are subtle, you can't see, and it's just a really good backup option.